Hey, it's Dr. Lakeisha Watson, epidemiologist and data storyteller, translating data into public health insights for Black women. Welcome back to Epi Fridays. And welcome to the final episode of our Black in the Day mini series. So, all month we've been talking about how history shapes health, but today I want to tell a different kind of story. Because when we talk about Black history and health, the narrative usually centers suffering and harm. So, we have things like Tuskegee, forced sterilization, experimentation, segregated hospitals, health disparities. And those stories are real, they're important, they matter. But they're also very heavy, and they're not the only story. There's another history running parallel to that one, a history of Black communities building health systems when the country refused to care for us. So let's get into it. Let's start with the Black Panther Party. Most people remember the image, right? Black berets, leather jackets, raised fists, okay? But what they were building was community-based public health. In January of 1969, they started their free breakfast program, and it began with just a handful of kids, but within weeks, it grew to hundreds, and eventually, it was feeding tens of thousands of children across the country every single day. And school officials noticed the difference. Children were more alert in classes. They weren't falling asleep. They weren't distracted by hunger. And that makes sense, right? Because the research tells us that malnutrition in childhood is associated with long-term metabolic risk, differences in cognitive development, and educational outcomes that shape health across the life course. So what the Panthers were doing wasn't just charity, right? They were interrupting a biological trajectory. They were also running free clinics, right? So screening for hypertension at a time when high blood pressure was devastating Black communities, and prioritizing sickle cell testing when federal systems had largely neglected it. They understood something public health now quantifies clearly. Early detection changes outcomes. So they weren't reacting to crisis at all. They were actually practicing prevention. And at the same time, Black women were organizing around their own health. In 1983, public health activist Billy Avery brought together thousands of Black women at a historic national conference at Spelman College. That gathering became the foundation for the National Black Women's Health Project, the first nonprofit created by and for Black women to advance their health and wellness. What made this movement so powerful was that it centered lived experiences, right? Black women created space to talk openly about what they were going through and the things affecting their health. They were talking about social determinants of health before we had a language for it. They understood even then that you cannot separate social conditions from health outcomes. Pioneers. Okay? And fun fact, today that organization continues its work as the Black Women's Health Imperative. And if you zoom out, you see this pattern repeating across generations. After emancipation, formerly enslaved people were left to survive in a country that had profited from their labor but invested nothing in their well-being. Hospitals were segregated or inaccessible. Medical schools excluded Black physicians. And public health infrastructure rarely reached Black communities. So Black communities, we built our own. So mutual aid societies pull money to cover healthcare and burial costs when insurance companies refused. Black physicians founded hospitals like Providence Hospital in Chicago, creating spaces where Black patients could receive care and Black clinicians could practice medicine. Black nurses trained each other during the HIV/AIDS crisis. Black activists organized education and care through churches and community networks when mainstream responses failed to reach Black communities. And even during COVID-19, we saw the same pattern again. Organizations mobilized testing, vaccines, food distribution, transportation, because the data showed disproportionate impact and communities responded in real time. There is a pattern here. When formal systems excluded Black communities, we built systems anyway. We addressed hunger, screening gaps, maternal care, mental health. What we were building was health infrastructure. We were identifying exposures, mobilizing resources, protecting our communities long before institutions validated that work. And that's what I want us to sit with. When we look at disparities today, I don't want us to only see gaps, right? I want us to see legacy, because embedded in our history is proof that we have always known how to design systems that protect our health. That is a story of communities practicing EPI before it was ever called that. These movements were blueprints for what equitable public health can look like when communities are resourced, trusted, and centered. And that is absolutely Black history. All right, y'all. Thank you for walking with me through Black in the Day. This has been such a special and fun mini series. I will see y'all next week where we continue the EPI journey. So until then, bye.